right, so this is Off the Cuff Nursing, and I am Dr. Minter.
And I'm Nurse Bryan.
CO Quinn.
And we are going to talk to you about booking. We've got a correctional officer with us who's going to walk us through what happens when you get arrested. Because Nurse and Bryan and I discussed it, but we're not the experts.
Correct.
And we didn't know the right names for the things.
Yeah.
So, like the food sucker thing and the thing that you put people through, it's like a big x-ray machine. So we want you to walk us through like what happens when you get arrested. You're on the beach and you got an open container and you get arrested. You just mouth off, right?
Okay, so I mean, I can't speak for the patrol side of what happens when you get arrested because I haven't been that exposed to that down here, but I can tell you about what happens once you get to the jail.
Do it.
So
tell us.
Basically, the arresting officer or a transport officer will bring you to the jail from wherever you were arrested. So you're usually handcuffed. We prefer that at the jail, that you arrive handcuffed.
In the front or the back?
We prefer in the back. Now, there are certain situations where an individual might be handcuffed in the front. Like, for example, a very pregnant female. Or even, discretionary stuff, like a very elderly person. You want these people, honestly, if they fall down, to be able to brace themselves or protect themselves somewhat. But from a safety point, a security standpoint, we would say we prefer them to be handcuffed in the back. So they arrive to our facility, and they typically pull into an area called the Sally Port, which is like a giant garage with roll gates on each end, and it's very secure. So the vehicle or cruiser will come in from one end, and before they can get out with their inmate, that needs to be completely secure. There's a control room where someone's working, and they're watching that area. And they're responsible for allowing those individuals into the receiving area, the intake area of the jail, and also making sure that that area is completely secure, and they kind of set the pace for the intake area. Like, obviously, if you had, 4 or 5 cruisers pull up at once, you're not going to be bringing in, 5 to 10 inmates all at one time. You need to kind of make that a more slow process, just because you don't know what you're dealing with. Sometimes the arresting officer will even give a courtesy call to the supervisor of the intake area and say, hey, I'm 51, which means on your way. I'm 51 with an uncooperative male. So that way, whoever's working in the intake area will understand that, okay, we need to kind of finish up what we're doing with all of these individuals, and we need to devote some serious time and manpower to this person that's coming in because they might be fighting. They might be, throwing up everywhere. They might not have clothing on. It's all different scenarios. You never really know what you're going to get as far as that goes. Or they may be completely fine. Maybe they just didn't agree with the arresting officer, and once we get out there, they're completely cooperative. So they pull in, they call us, we go out. Typically, it's a supervisor with at least 2 to 3 deputies or officers, and the individual will be handcuffed in the back of the cruiser. That's the ideal way it all goes down. If the person has been known to be uncooperative, we have a conversation with them, typically through the vehicle's window, and try to assess whether or not they're going to cooperate with us. Are they going to comply? And sometimes it's like, F you, I'm not doing anything that you say. You're going to have to drag me out of here kicking and screaming, and we do that. Or it may be, you know what, I don't have any problem with you guys. I'm just upset that I got arrested. I'll come with you. And then it's like you just open up the door and they just come in. Same scenario, if the officer brings them and they're completely cooperative, like it's bad check or, trespassing or something. Typically these people, they just come in and they just go through the process. It's not that big of a deal. In that case, we don't go out to them. They come to us. So anyway, they come into the facility And then the first step, while they're still handcuffed and everything, is to go right to a wall with like a background on it, and then they get their facial recognition photo done. So the photo happens, and they're not always happy. Sometimes they're overly happy for the photo. Sometimes it's like Olin Mills, photo, and you get this big smile, and you think that they're saying cheese. And sometimes they're very grumpy, and they close their eyes, and they don't want to participate. But we do our absolute best to get a photo, because that's really the first step. If they've been there before, that will pull them up right in the system right in front of us. It brings up all of their demographics, all of their information, and then we can just go ahead and build on what's already there. If they've never been to the facility, then we take that photo and then we start from scratch and we have to build it. And then they're issued a docket number which follows them through their entire incarceration. And if they come back for another incarceration, they get a new docket number. They don't just keep the old one. It's kind of confusing, but that's the way that it works for the records situation. So after the photo, they're taken to the counter, the booking counter. There's a few of those there. And at that point, there's usually an officer that is at a computer, and they're responsible for inputting information about that person. And then there's at least another officer standing near or behind the subject, and they do a pat search of them. And that's a thorough check. It's extremely important that they get checked and thoroughly searched there, because things have come through like knives, even guns have made it in, drugs, lighters, all kinds of things. Anything that people would have inside their pockets can come in. So that first pat search is crucial for safety. So once they get that pat search done, typically if they're cooperative, we take the handcuffs off. And then we have their belongings. If they have any belongings, cell phones, wallets with credit cards, cash, jewelry, all of that stuff. If they're wearing it, it needs to come out and it needs to go onto the counter. If it's in a bag already that the officer already bagged it up, it goes onto the counter. Everything gets verified right in front of that inmate, as long as they're cooperating. So as long as they're cooperating, they can look right at the counter in front of them, and you can say, okay, here, this is your watch. Here's your 3 rings. You came in with $15 cash, and go on so on and so forth, so that there's no discrepancies. Sometimes you will have an inmate that'll say, but I came in with 300 cash and this is only 30 or whatever. And that's for verification with the arresting officer. They can handle that with them. But as far as us, we have excellent cameras, excellent audio. There's no way to really, if you came in with $300, we know that you have $300. Like, there's no way to mess that up. Once that takes place, you go through a further search. Like if you have a felony charge or a weapons charge or a drug charge, you'll get strip searched and you get placed in a inmate uniform. If you don't have one of those charges and you have something very minimal like petty theft or trespassing, we'll hand you a uniform and you can go into the cell on your own and change out into an inmate uniform. But at the end result is that everybody in that area gets an inmate uniform. And then they go through a secure pass, which is, it's actually called a con pass at our facility, but basically that's kind of like the airport scanner, where there's like, electromagnetic rays that go through the person's body, and it detects abnormal densities. So say an inmate, just hypothetically speaking, say a female inmate decides to take only because this has happened, a Mercedes key fob for a car and place it inside of her vagina and go through the process, that machine will detect that item. It's actually very good. It's pretty clear image. I've actually seen the Mercedes symbol. So
wow.
That's how good it is. Yes. Not much gets through there. Mm-hmm. But it's an awesome tool. Sometimes you can see like baggies with drugs. It's the denser the object is, the better it shows up on the screen. So I think that's important to say. Some stuff can get through, but we do as much as we can to try to maximize safety and security up there. So once they get through that, they'll go and they'll sit in a holding cell up there in the intake area for a little while. And then they'll eventually be escorted back to the processing area, which is like almost kind of like a large, like an airport gate where you would sit and wait for your plane, except for they're not going anywhere except to the gym. But there's TVs back there. It's not comfortable seating. It's like hardback chairs. But the reason they're there is to go through a series of steps that is part of the booking process. So, for instance, they get photographed. Their tattoos get photographed and documented. They go through fingerprinting. They see a nurse that screens them and goes through any of their medical issues or medications and things like that, which I'm sure you can expound on a little more. And then they go to classification, which will ultimately look through their charges, look through their prior history if they have one. And there's a point value assessed to that, and then they'll get housing based off of that. So it's a pretty lengthy process. You know, if it's running really smoothly, I would say it's a couple of hours that a person could be in there, but we've seen people be in there for like 12 to 15 hours, especially lately. It seems like it's a very slow process lately. So while you're in there, typically once you've finished all those steps and then you're just waiting to go to your housing, you can use the phones. There's telephones in there, and those are free calls. Any local calls are free.
What if it's long distance?
They can make collect calls.
So what does it say? Does it say, I'm calling from Acme Jail?
Yeah, I think on the other end, it'll say, like, you have received a call from the Acme Jail, and then you decide whether or not you want to accept it.
Oh, okay.
And typically, these phone calls, you know, inmates can't wait to use the phone. That's almost always their highest priority when they come in. They just want to get on that phone, whether it's to call a bondsman to try to get out, which would be my first priority, or if it's just to call mom and cry because you're in jail again and you need mom to know that you're there and, you know, you're a victim, or if you want to call, you know, wifey or hubby or whatever it is and let them know. So typically, you know, one thing about that area is the calls start off very sweet and kind. It's like, you know, so for instance, say an inmate decides to call his mother and he wants his mom to help him out. So it's like, hey, Mom. Yeah, I'm in jail. Yeah, I know. I didn't do anything wrong. They got me in here again. I shouldn't be here. I know. I want to come home, though. I'm supposed to start that job tomorrow. Can you help me out? Can you put... I know I'm here again. I know, but I'm not supposed to be here. Mom. No, Mom. You know what? If I can get out of here, I'm going to kick your ass. I'm going to kick your ass, Mom. I'm done. That's it. I'm done. I hate you. I hate you. I hope you rot in hell. So, obviously, that phone call situation, we can't tolerate it once it gets to that level. We usually go over, we send a couple warnings out. You know, you got to keep it down on the phones. But if that persists, we take them right off the phone. We have the ability to shut the phone call down, or we actually remove the inmate from the phone bank and take them away.
Those phones have been through some serious
I've seen those phones.
I mean,
like,
when I say
bam.
abuse, I mean, it's
Yes.
bad.
Yes.
I'm like, how are they still standing? How are they still together?
Well, they're bolted to the wall.
They are.
God, still.
They're attached to concrete pillars. And I mean, they take some serious abuse, slamming those phones, letting those phones just dangle on the metal coiled cord or whatever you want to say. But yeah, I mean, and realistically, that's all there is to the intake process. That's really it. That's all that they can do. They can get up, go get some water from the water fountain. They can go to the restroom, and they can use the phone and watch the TVs. And typically the TVs are like, you know, something really bland and not very exciting. But every once in a while, we'll throw something in there. But yeah, I mean, there's not much to do. And after that, they go to wherever their housing is, and then hopefully they can bond out or go see a judge the following morning and get out of there.
So then how do they, we talked about in a previous podcast, I think that I've heard him say you can have 3 numbers or something.
Oh, so yeah, that would be important to know. So back when you first come in, they take the photo and they go to the counter. As long as they're completely cooperative, we typically would extend them the opportunity to get some phone numbers. out of their phone. We don't love to hand them their phone because even though we say don't text or call, sometimes we see things happening. We see phone calls going through or texting. They try to get a fast one in.
Help me.
Yes, exactly. SOS, jail. But realistically, we will let them look through it. As long as, like I said, they're cooperative, they can write down a few numbers because who really remembers all the numbers these days? I mean, I personally don't. I only know a couple people that are very close to me, and I would have to write down the rest. So, yeah, we try to extend that to them as a courtesy because, honestly, we want them to get out of jail. If you can bond out or get out of there, get a hold of a family member to post your bond and take you out of there, then that's better for everybody.
Do they have to see a judge?
Well, if you bond out, you don't have to see the judge. You can go ahead and follow up with your court procedure after that happens. You get instructions when you leave as to what to do. But if you're going to stay there and you can't bond out, yes, you will see a judge.
So how do you know whether you can bond out or not?
Well, when you're in that large room, the processing room, like at our facility, you can ask the officer, and the officer will tell you if you have a charge with a bond attached to it. And they'll also tell you when you're able to actually bond out, when everything's processed enough in the system that you can utilize a bondsman. Also, the bondsman will know. There are lists in that room available to the inmates with, anywhere from, I'd say, probably 60 different bail bondsmen's names and numbers on there, and they can choose and they can call, and the bondsmen have access to our systems at the jail, and they can tell them, hey, I can help you out with this, or I can't. This is how much money I need to get you out of jail, and things of that nature.
So they don't necessarily have to see the judge.
Right. They don't. That would be the first. That'd be like the advisory. A lot of people know it as first appearance. Sometimes it's beneficial to go to that if you have a very minimal charge, because the judge could just let you go. They could release you on your own recognizance, R&R. It's actually ROR, but the inmates say I need some R&R, and it's like, yeah, we all do. But no, I mean, seriously, when they get in front of the judge may say, okay, you're here for, trespassing at such and such bar or restaurant. What do you have going on? Usually the judge likes to establish what they have in their life. Like, do they have any attachment to the community? Are they a productive member of the community? Things of that nature. And then they'll be more likely to release them on their own recognizance.
And then is a judge there every day?
Yes, we always have judges. Weekends, holidays, every day of the year for first appearance.
So I wonder if some of the smaller places have a judge every day.
Probably not. I would say no.
Have to wait till Tuesday after a holiday weekend to wait for the judge.
Yeah, I would
right?
think that some facilities may not have anybody there on the weekends, especially.
Or you can get the bondsman, I guess. Or if you're nice to your mother.
Very
Right.
nice. If she hasn't already been through it 20 times, she might help you out.
And then what happens? Then you go to housing?
Yeah, exactly. So from that room, you are sent to housing. And then that's where you stay until you go to your next court appearance, or maybe something happens in the meantime and you can have somebody post bond, or you're able to get some money together and get out.
So how long does it take to post bond?
Well, from the time that you get a hold of somebody and they post your bond, it's usually like 3 to 4 hours. That's the extent of that process. As long as everything in the system is working the way that it should. I would say somewhere between 3 and 4 hours.
So somebody's got to, like if I got arrested, then if I called Nurse Bryan to come get me out of jail, then she would have to go to the jail and pay the bond.
Yeah, I mean, depending on the facility, I think that some facilities allow you to pay it by phone now. There's ways for it to be paid by credit card. Like, for instance, if you came into the jail and you had your credit card with you in your purse or whatever you use, you could tell me, or you could tell the officer, hey, I have money, even if you have cash. If you have cash or credit card and you say, I just want to use my own, then we can make that happen. We can call the records area and say, hey, this person wants to use their American Express to pay their $2,000 bond, and we can do it that way. Or if you have the cash available in your wallet, we can say, hey, this person has $2,000 of cash with them, which isn't as common, but it does happen from time to time.
Yeah, it does. They come in and lots of money on the table. I'm like, oh,
Like
yeah.
like $1 bills.
Oh, yeah.
So it was a good night?
Oh, you're right.
Why?
Stripper.
$1 bills.
Really?
Yeah.
Oh.
Yes.
And they're all like crinkled. And
Yes.
they're like, all right,
And sometimes they're wet.
Yeah.
yuck.
Yeah. I was working in a small facility, and the talk of the day was, I guess some guy got arrested. I don't know, it was a rapper or something. He just came in with like bundles of money to pay the. I mean, it was probably would keep the county going for, the entire. It was probably more than the county's operating budget for the whole year.
I think at our facility, we've seen a couple times where individuals come in with like $4,000 or $5,000, and it's like a mixture of like small bills and change, and then we've had to count that.
Yeah.
And it has to be counted multiple times and verified.
Really?
So yes, that can be very tedious.
I would probably come in with pennies just to, right?
Yeah, you
Count
could.
every single one.
If you planned it right. Yeah,
So then
that's right.
The bail bondsmen, they just, so they come and they pay the chunk of the bond.
Well, yeah. I mean, I'm not, like I said, I don't want to speak for the bail bondsman because that's not something that I do. I'm not really privy to what they do, but I know that typically they require like a 10% of whatever the bond is. So if an individual comes in and, their bond is $5,000, then they can anticipate that they have to pay the bondsman $500.
So they put up
then,
money though.
Yeah,
for-
and then basically the bondsman covers the rest for them to get out of jail, and then if they violate that and they don't come through, then the bondsman can revoke their bond and put them back in jail. And same with the individual. Like sometimes an individual might have to put up like a car for collateral or something like that to cover the remainder of the amount. And if they don't make good and they don't go to court, the car can be taken. It can be seized from the bondsman.
Okay, like the bounty hunter.
I've seen that on TV where they're like, "Don't take it," and like try to get back in. I've seen those episodes.
Well, then when
because
they
they put it up for like you said collateral, right?
Yeah, basically.
They put that up, and then they went to go take it but it wasn't them. It was like whoever they bonded out, right? Is that how that worked? It was like because they're held accountable for the person, right?
Right.
Yeah.
Right. Yes. Yeah, like I said, I'm not an expert on the bail
I'm not
bondsman
either.
process.
no, but they just put up money though, right?
Yes.
That's like the basic. Of
And
it.
they make money from the 10%.
I see. Then what about what's the ankle monitor thing? So like if you need an ankle monitor, say the judge says, I guess the judge says you need, I don't know who says it, says you need an ankle monitor for whatever.
Yeah, well, there's ankle monitors for different reasons. Like there are
Like what?
the alcohol monitors, which again, I'm not an expert on it, but you have like, the alcohol monitors, like a person has persistent alcohol related charges. I think recently we had someone come in on like their 4th or 5th DUI. And, that's pretty significant. So when that person was released, it was a requirement that they had to have a monitor put on. And I don't really know what the ramifications of that are. You have to stay in your house, you get monitored. I feel like with that, there's like some kind of a base where you actually have to like blow into something at your house so that it registers your breath to determine that you haven't been drinking any alcohol. And then that information, gets stored or whatever on the monitoring system and relayed to the, the personnel that monitor them. And then there's like alternative sentencing where sometimes the courts will determine that someone doesn't really need to be in jail as an inmate, but they still need to be held accountable. They still need to be monitored in some way. So they'll get an ankle monitor, which is more like what you see on TV where a person might have like an ankle monitor and they can't leave their house, like house arrest type situations. And there are stipulations and exceptions for all of those. Sometimes people can still work. They might have a stipulation that they can only go to work and home with that. But like, I don't know. That would be interesting to know more about that. We should invite somebody that could be an expert on that.
I know.
When I worked at a correctional facility in another state at another time, somebody showed up to work at the correctional facility with an ankle monitor on.
Really? to work there.
Yes.
Okay, so they were.
Maybe they were allowed to go there. The
They
tracking
didn't
device.
last,
Maybe they're just
but,
allowed to go there.
I mean, what more safe to work in a correctional facility
Oh
Probably.
my
when you're on
gosh, right.
an ankle monitor? I mean, it doesn't get more safe
No,
than that.
that's true.
That's pretty low risk.
Now I do see when they come into booking, I do see them take them off when they come in.
Yes,
I see that all the time.
a lot of times.
Yeah.
They will take them off, or they at least have to call the entity that's responsible. And because I think those alcohol ones, I think those are very expensive. I don't think you can just cut those like with a pair of scissors.
Yeah.
So someone will have to come in from that entity and actually remove it.
Okay. Well, we're at another end of a podcast. So I am Dr. Minter.
And I'm Nurse Bryan.
CO Quinn.
We will see you next time.